Is there a common fear or phobia that you would see a lot of in your clinic?
Fears and phobias in Ireland have crept up more and more over the years because of the way our lives change. Different fears, different phobias come into me all the time. But the most common one is, for example, fear of a dog. And people say to me, how come they have a fear of a dog? I'm an adult, I love dogs, I love animals, but I can't go near them. Well, a little example would be here of, think of taking little Johnny for a moment. Little Johnny has grown up, he's now a grown man and he's happy enough in his life, but he won't go near a dog. He's got this fear, this phobia of a dog. Why? When I questioned little Johnny, when he was a baby being pushed around in his pushchair, and it was, for example, a beautiful summer's day, and his mum was taking him for a walk, and she comes across Mrs. Battersby, who lives next door to her, and she pushes little Johnny over in his pushchair to see Mrs. Battersby, who's a lovely, lovely woman. And while they're standing talking, Mrs. Battersby's dog, who is a big, friendly old golden Labrador wagging his tail, comes over to say hello to little Johnny. The only problem is that little Johnny is sitting down in his pushchair, looking directly into the face of this slobbering, teeth lolling with a big tongue dripping. That's all little Johnny sees. Now, his mum doesn't realise that, or Mrs. Battersby doesn't realise that, but little Johnny realises that this is fearful, this is a monster, I was told there's no monsters. And they grow up with this fear. So fears can be caused by something as simple as that, but it's not simple to little Johnny. He thinks he's seen a monster when he's a baby, and he's grown up with this fear. Likes per like with other people as well. Everybody can grow up with a fear or a phobia can be brought on, and they have to be dealt with by finding out the root cause of what the fear is, dealing with it, and once again putting it away so it doesn't bother the person anymore.
Is it necessary to be able to remember the incident that triggered the phobia in the first place for successful treatment?
9 times out of 10 when people come to me, they haven't a clue what caused it in the beginning. And it's only by using therapy, whether it's psychotherapy, whether it's counselling, whether it's analytical therapy, of finding out what the root cause is. But there always is a root cause for the problem. And when you find out what the root cause is, like in little Johnny's case, you can solve the problem.
So Johnny may not be able to remember the root cause, but you can uncover that during the therapy process?
You can. Johnny just doesn't want to remember it, but he knows he's put it away in such a way that he doesn't want to deal with it.